Thank you everyone for coming today. My name is Nancy Bell and I'm with the West Piedmont Health District. And we have quite a few people who you're going to hear from today. And the first person is Penny Hall, the Chief Operating Officer for the district. But before she comes up, I wanted to let you know that we do have a Spanish-speaking person here today who can you can interview on camera if you wish or otherwise. And that is Alfredo Garcia right here. So he's ready for his close-up. Without further ado, I'll introduce Penny, and please hold your questions till the end. We're all going to hang around and answer your questions after the press conference. Thank you.
Thanks, Nancy. Good afternoon, and thank you for joining us today. As you know, COVID-19 cases in Martinsville and Henry County have surged in the past several weeks. We have come together today to describe what we collectively are doing about this and also to ask for your help. Today, 219 citizens of Martinsville and Henry County have tested positive for COVID-19 and 4 deaths have occurred. The number of cases tripled in late May, and this has been very alarming for a number of reasons. This was a result of several workplace outbreaks, as well as family gatherings where social distancing was not observed. Fortunately, as the first positive cases appeared in our area, the Harvest Foundation was already at work pulling together partners to address the looming crisis. In less than 2 weeks, the team put a collaborative idea into action with the opening of the testing site at the Martinsville Speedway. The people you see here behind the podium with me today were all instrumental in this process. In the early days of our testing site, a dozen people were tested daily. Now nearly 100 people are tested each day. Health District personnel have provided test kits and PPE, as well as guidance through our call center, partnerships with the media, and workplace guidance. The recent surge has resulted in training our nurses, restaurant inspectors, and clerical staff to take on this critical need for contact tracing. 7 days a week, we are working to keep you safe as we identify outbreaks and provide guidance to companies and other groups. But we need your help, and that is our reason for today. The health department needs volunteers who can speak Spanish to assist us as we reach out to our Latino community. And we need our companies to partner with us for immediately when COVID hits the workplace to assist contact tracers in identifying close contacts at work and to enforce hygiene measures for all employees. Only if we all move quickly and in unison can we stem the tide of new COVID infections. Finally, please wear a mask when around other people. Wearing a mask and social distancing at present is the most effective and easy thing to do to curb the spread. The life you save may be your own. And now I'd like to have Jim Adams, the chairman of the Henry County Board of Supervisors, come up and speak with us.
Leave this in case it rains.
Okay, thank you, Penny. As she said, I'm Jim Adams, chairman of the Henry County Board of Supervisors. I'm here today representing the board along with Vice Chairman Deborah Buchanan and our county government. Literally, I stand here with everyone, each and every one of you all, saying, please do what is right. We've heard the numbers. We know that as a community, the community has always stepped up and responded well. This is a time for action. Step up, do the right thing. Wear a mask, practice social distancing. Think of others before yourself. Matthew 22:39 says it best. Love thy neighbor as thyself. There's nothing vague about that commandment. It doesn't say love thy neighbor if it's convenient. It doesn't say love thy neighbor as long as you simply don't have anything else to do. It just says love thy neighbor. Likewise, in the 11th chapter of Luke, all of us are familiar with the parable of the Good Samaritan. When the question was asked as part of the parable, who is my neighbor? The conclusion to the parable is those that have need. Our community has a need right now. Our community is asking you to respond to that need, and it's not a directive that everyone that should follow. Our community needs this. Please take it seriously. Thank you. It's at this time, it's my pleasure to ask to the podium the Honorable Mayor of the City of Martinsville, Kathy Lawson.
Thank you, Jim. Good afternoon. I'm Kathy Lawson, and I'm representing Martinsville City Council and the City Administration. I, too, am appealing to our citizens to do what's right. We are not out of the woods. Each day we see new positive numbers from our COVID testing. We understand people have had enough of social distancing, would love to be able to go out and socialize. And even though our governor has lessened the restrictions and allowing reopenings, now is not the time to simply abandon all of the safe practices that we have discussed. We have implemented these over the past several months, and we still need to maintain social distancing, wear a mask when and around people in close spaces, wash your hands frequently, and be aware of common touch surfaces in public spaces. Every day when I get off the elevator at my workplace, I sanitize my hands because I've touched that elevator, and everybody should be doing that. I carry sanitizer in my purse. When I get in my car, when I leave here today, I will sanitize my hands. And I just can't emphasize enough to everybody how important this is. Our community's safety is at risk. We need to stay the course and continually be proactive to stop the spread of this virus. Now is not the time to say, oh, we've gotten past this, because we are far from being past it. And now it is my pleasure to introduce Kelly Fitzgerald from SOVA.
Thank you, Kathy. And good afternoon. My name is Kelly Fitzgerald. I'm the Market Director for Marketing and Communications for SOVA Health. Dale Allward was unable to join us today because we are hosting a parade to celebrate our 50th anniversary shortly following this news conference. We're honored that NASCAR Blue MU and the Martinsville Speedway has chosen to help us not only celebrate our anniversary, but also to celebrate our healthcare heroes. NASCAR haulers will circle our hospital to honor our heroes, as well as we'll have a short ceremony following. SOVA Health supports wearing face coverings, as well as practicing social distancing. Face coverings do help slow the spread of coronavirus, especially to help protect others in case you are infected, but you do not know that and you're not experiencing any symptoms. Who should not wear a face covering? Children under the age of 2, anyone who has trouble breathing, or someone who is unable to remove the mask without assistance. I thought I would share a few tips from the CDC on how to safely wear and take off a face covering. First and foremost, be sure to wear it correctly. Wash your hands before putting it on and taking it off. Put it over your nose and mouth and make sure it goes under your chin. And also make sure that you're able to breathe easily. Don't put the face covering around your neck or forehead. If you need to remove it, please remove it completely. When removing your face covering, handle only the ear loops or the ties. Fold the outside corners together and place in your laundry machine so that it can be laundered. And also wash your hands after removal. As Kathy alluded to, washing your hands is the best thing that you can do. And if you're not close to soap and water, hand sanitizer is the next best thing. Personally, for me, I don't wear a face covering to protect myself. I wear a face covering to protect you. Therefore, we ask everyone in the community to wear a face covering in public so that we can protect each other. Also, I want to assure the community that it is safe to come to the hospital to seek care. Please do not hold on whatever ailment that you're experiencing. We are prepared and ready to take care of all needs. And at this time, I would like to introduce Dr. McZurek. He is our emergency room medicine physician, as well as the director for the emergency department.
Yes, good afternoon. My name is Bruce Mazurek. I'm the Market Medical Director for Emergency Services at Sova Health. And I'd like to reiterate what was just said, that our emergency rooms in both Martinsville and Danville are very well prepared. Our employees there are very safe. I feel very confident in telling you all that we have a very safe environment, and our patients are well protected and they are kept safe also. So I'd like to reiterate that point. If there's something that's ailing you or bothering you, don't put that off. Our hospital is a safe place to come to. Regarding our illness that we have with respect to COVID virus, just coming here this afternoon, I looked at the most recent state data, and they put it in a way so that you can compare apples to apples, okay? Based on our current population of 100,000, and that's how they compare it throughout the state. Martinsville and Henry County is just over 300 cases per 100,000. To give you an example, Danville, Pennsylvania County is 80, okay? We're almost 4 times greater, so we do have a problem here. And we're here to let you know that, to inform the public of that, that we are not out of the woods. From a personal standpoint, I've traveled to 3 different parts of the country in the last month. I've been to a small college town in Mississippi, Oxford, Mississippi. I've been to Washington, D.C., and I've been to Damascus, Virginia. Very small community in the western part of our state. All places that we've been to, every retail shop, service, retail service center, customer service, retail shop, every one of them in all of those communities require a mask to enter the store. And I'm here today to reach out to our retail business and make that happen here. It's to protect the community, it's to protect the employees, and it's to create a safe shopping environment. Okay, I think this is vitally important. And that's the way I feel that our local community should handle this. That's one of the things we can do. Because there's definitely community spread in our area, and this is one thing we can do to stop that. Thank you.
Buenas tardes, mi nombre es Alfredo. Estoy aquí para hablar con la comunidad latina y el propósito es para urgirle a la comunidad latina de que si se sienten enfermos pueden ir al hospital. Si se sienten enfermos, tienen síntomas de que es relacionado a coronavirus, que por favor llamen a su doctor para sacar una cita y vayan a donde hacen los exámenes. También el Departamento de Salud está pidiendo ayuda para gente que habla inglés y español que puede traducir, que ayude al Departamento de Salud. Llamen aquí para ser traductores y por favor, si se sienten enfermos, llamen a su doctor y para sacar una cita para hacerse el examen. No tengan miedo de salir al hospital si necesitan ayuda. Gracias.
Thank you, Alfredo. Good afternoon, my name is Tim Hall. I'm the Henry County Administrator, and I thank everybody for being here today. My message is for our businesses, retail, commercial, and manufacturing. I thank all of you for what you're doing to help us fight the coronavirus and its spread. We need each and every one of our businesses to lead the way. We need you to be vigilant with your customers and with your employees. We need you to help set the pace in this fight. This fight knows no socioeconomic boundaries. It knows no racial boundaries. It is equal opportunity. We need our businesses to help us remind everybody that this fight is not about us, and it's not about how tough we are, or how much of an imposition it is to wear a mask, or how we just don't think we need to. This mask, go Dukes, weighs less than 1/3 of a pound. And I'm going to put that in terms that I can relate to. That's smaller than a cheeseburger. Okay? It's not that heavy. You owe it to yourself, but more importantly, you owe it to the people around you to put this thing on. Just put it on. Can something this small really make that big of a difference? Absolutely. put it on. Help us set an example. The quicker we set the expectation, the quicker we get back to where we used to be. And that's what we want out of this. That concludes my remarks, but there's several folks here who represent agencies and departments who didn't have a speaking role, but they showed up to show that this is a team effort. And I'm sure I'm going to miss somebody. Please forgive me if I do. But the Harvest Foundation has several representatives here. David Stone's on the board. Several other folks. Carly Foster's back there. As was said earlier, we would not be in as good a shape as we are without the Harvest Foundation stepping up and providing funding for that testing center that we have in place. We wouldn't have it. We'd have to leave the community to get tested. The Henry County School System is represented. School Board member Ben Gravely is here, as well as two of the preeminent school nurses of all time, Sherry Vestal and Lisa Gardner. Thank y'all for coming. Sheriff Perry with our Sheriff's Office is here. Matt Tatum and some of his folks from the Henry County Department of Public Safety. The EDC is represented here as well. And Chamber of Commerce, Lisa Watkins asked me to tell you that she had an appointment out of town, or otherwise she would have been here. If nothing else, let's take this away today. This saves lives. Wear it. And this is a community effort to reinforce that for you. So I thank you for being here. Nancy, anything else?
Our brave health department staff are standing under this awning. They have worked 7 days a week since the beginning of March. And I just want to give them a heads up. We'll take some questions. When you ask your question, state who you want to answer it, and then they'll come up to the microphone.
Nancy, who would be the best to answer testing questions?
I'll give the staff.
One question I've been getting is that when somebody comes after they healed up, do they get a second test? And does that count in these numbers?
I don't believe retests are counted in the numbers. Stop me if that's not right. I'm going to introduce you to Sharon Ortiz Garcia, our epidemiologist. Don't keep her long, she's very busy.
Yeah, so, no, people who's retested should not be counted, should not be counted on that. We have a lot of people who's being retested that happens to continue to test positive, but those new positives are not added to the count. I can assure you that I look at our data every day, try to make sure, because I know there's a lot of questions have come up that Virginia is recounting all these new positives. No, that's not what's happening. You have a case, but that case can possibly continue to test positive for 6 up to 8 weeks. Have we seen it? Yes, we have seen it. We have, unfortunately, several cases that have continued to test positive after symptoms have resolved. They're healthy, they're fine, but they continue to test positive. But no, those are not counted as new cases or added to the count.
All right, how about one more question? The people that aren't positive, we never get that number, because I think it's an important number into the overall thing. Because I had spoken to a funeral director Friday, and he says that the local deaths are down compared to last year. But my big question is that on these readings we don't get the folks that are healed or the folks that are cured.
Okay,
the numbers just seem to keep compounding.
So basically your question, it has to do with that, it's a cumulative count, okay? So VDH, that's the last information I had a couple of weeks ago. VDH was trying to come up with some numbers on the recovered people, but we don't have any guidance regarding that yet. And we as a health district, our health director likes to get the guidance from VDH before going ahead and saying it, but this is the number of people who have recovered. Yes, we have placed a lot of folks from that count out of isolation, meaning they have met the criteria to be out of isolation, that they have recovered. We follow CDC guidance when it comes to that. But we don't have, yet we don't have enough guidance from VDH when it comes to that type, of data. We have asked it as health district because we get that question all the time. So hopefully central office will be able to give us some more specific guidance on how to report those at the local level.
And what are we doing wrong? What do you think we're doing that's making our numbers so high?
Personally, I think, and I know, we're getting ready to open. We're open with phase 1, phase 2. And a lot of, Dr. Masurek, Mr. Hall, everybody have talked about, are we relaxing? Are we abandoning the social distance? Are we abandoning using these? Mr. Hall said this is not heavy at all, and that's what I'm seeing, okay? Because I've been a member of this community for 16 years, okay? I have to go do groceries because I have to eat. When I go into a grocery store, I can tell you probably about 80% of the people is not wearing this, okay? I feel that our community, that we are relaxing and abandoning the only tools we have to be able to keep our numbers down and to help the numbers from the pandemic come down, okay? This is what we have to do. I know it's hard. I'm a very social person and I have to change my life. I had to do it. I had to postpone trips. I have to postpone, meeting with my family, seeing family and all of that, but I had to do it because I know it's what's gonna help not making others sick, okay? Because if I have it and I don't know I have it because I happen to be asymptomatic, not wearing these is gonna make a lot of people sick, probably. So I think that's my feeling, that's what I'm seeing, public health wise. I think we are abandoning a lot of the social distancing, a lot of the using, a lot of the recommendations, and that's what cannot happen. If not, we're not gonna be able to keep our numbers down. I don't wanna see any more cases.
But it's the workplace, the work problem right now?
We have, I cannot tell you about specific workplaces. I can tell you what I see in my personal life when I go out, what I see, in some grocery stores, you go in, a lot of people's not wearing masks. You can see a high percentage. You can see the staff wearing masks, but you don't see the customers wearing masks. So I think that is a contributing factor. You can see it, anywhere that you see a lot of people that's not wearing it. So that's basically me as the epidemiologist for your health district. That's what I'm asking. All these people here have asked the same thing. I'm not gonna ask for anything different. That just continue to follow social distancing, wear a mask, and what the CDC and VDH is saying to put a stop to this.
Okay, I'm gonna let her get back to work. Any other questions? No? Where do you want?
Well, we keep saying that it's in the workplaces, like, that we're hearing about the headlines and so forth. Are they not doing social distancing enough at work, or, I'm just trying to pin it down. What do we?
When there's someone who's sick at a workplace, we work with them, with the employer, as well as the employee. So we will recommend extra hygienic standards they can take, talk to them about social distancing, say get some masks in here for your employees, make your employees aware that there are some people with a positive, so that everybody can have the knowledge to keep themselves safe. So an outbreak can take place at a factory, it can take place at a gas station, in someone's home. That's the reality of it. And
Have y'all spoken to Walmart, Lowe's, and places like that to make sure they get the message?
we're doing it today.
One of the biggest concerns with employees is they say that they are told by their employer that they cannot talk about positive cases in the facilities. What do you advise to those individuals?
I don't think there's anything we can do about that. We are already on the edges of HIPAA, just trying to trace everyone who the sick person has been in contact with. And I get a lot of calls from people that work at companies, and it stops with us at the medical realm. We can advise companies what to do, but we can't police them. We give them guidance from OSHA, from VDH, from CDC, and we can't get into the employee-employer scenario.
Does that guidance you provide tell them to have their employees withhold, or does it encourage them to tell their
No, not at all. We think the way to capture this virus is to be transparent. We need to know where it is at all times, who has it, who they've been in contact with. So knowledge is power when it comes to fighting this virus.
Have the stores been the worst place?
Sorry?
Have the stores been the worst place for contamination? What did your science say?
No.
Okay.
Are there locations that have been particularly bad? Like, if the stores aren't the worst place, is there a place that has been identified as the worst place?
We have had some workplace breakouts, but we work in partnership with our corporations not to call anybody on the carpet because the next company will not call us if they think we're gonna hang them out to dry, so to speak. We're working with them behind the scenes, and for the most part, they're doing what we're asking them to do. You may say, why do we have this news conference so quick? You just got the message on Friday and here it is Monday. Because with this virus, you cannot play around. It's quickly moving and you've got to be there we've got to do whatever we can do. So we really want to get the message out today that it is a problem here, it's still a problem here, and it's going to be a problem here unless we all work together.
I think one thing when people talk about not meeting with anyone, they say that they can still meet with family. We talked about some outbreaks in families. Is that correct?
Yes. Some people maybe didn't observe Mother's Day or graduations or Grandpa's birthday. And, when you go out in the world, I know we have to work. You go to your workplace, you go to the gas station, you pick up some groceries, you're exposing yourself and others if you're not wearing a mask and doing some basic things. So, we have elderly people in our family, we have young people in our families. We just need to, be cognizant of that. We all have to make sacrifices right now. Anybody else? Any questions?
We've had a good number of children in the recent week or two. Is that above what the national average is tending to be, or what is that coming from?
I don't know. I haven't researched it, Holly. We can look into that.
Thank you, Liz.
I have a request for a friend. Do you think you could talk to his Hispanic community about the proper way to wear a mask?
Yeah.
It's a handout from the CDC, and we have on our website that shares how to properly wear it.
Entonces, obviamente, todos debemos estar usando máscaras cuando salimos en público. Aunque tú no te sientas enfermo o no veas, la otra gente no se ve enfermo, lo importante es tener la máscara. Y lo importante de tener la máscara es de que si tienes como estos, que nomás son, tienen sus ligas aquí, que son la mayoría de lo que son, ponlo uno de una oreja, otro a la otra oreja, bájalo abajo de tu barbilla, encima de tu nariz, y asegura que eso esté apretado y que esté apretado a tu cara. Obviamente, si hay gente que tal vez no puede, tiene problemas de salud, si tienes problemas de salud, habla con tu doctor, ve qué te recomienda para usar. Niños bajo de 2 años no tienen que usar máscaras, pero aunque no te sientas enfermo, es importante para la otra gente que sí se puede enfermar fácilmente usar una máscara. Esa es la recomendación de la CDC de cómo usar las máscaras.
Y también es importante que los usen cuando van a las tiendas, ¿verdad?
Sí, entonces cuando salen en público, sea la tienda, sea la gasolinería, sea nomás a ir a lavar tu ropa, tienes que usar tu máscara porque simplemente tú no sabes con qué te vas a contactar. Aunque ellos no estén enfermos, pueden o no enseñan síntomas, ellos te pueden contagiar todavía. O tú a gente de que son vulnerables a esa enfermedad o se pueden enfermar más fácil. Es importante usar esa máscara para todos.
La última pregunta es también no tenerla abajo de la nariz, porque si uno lo tiene abajo de la nariz, no funciona.
Entonces el propósito de la máscara es cubrir tu boca y tu nariz. Entonces cuando usas la máscara abajo de tu nariz, no es el propósito de la máscara, entonces no sirve en ese momento, pues en verdad, es tu nariz, por eso la CDC dice no tocar tu nariz, tu boca, tu cara, tus ojos cuando sales en público, lavar las manos, tener hand sanitizer, por decir, ¿no?
Sí.
Entonces, cuando usas la máscara, que cubra tu nariz, tu boca y que estén bien alrededor de tus orejas.
Muchas gracias, Alfredo.